a small quiet town, a very smart doctor came to talk to students and teachers at Women's University. She was a famous gynecologist and was going to talk about something very important: getting ready for having a baby. The room was full of people who were excited to learn from this smart person. When they started talking, everyone clapped and listened carefully. "Hello, everyone. I'm happy to be here to talk about getting ready to have a baby," they said with a big smile. They started by saying it's like planning for other things in life. Just like we plan for school or work, it's important to plan for having a baby. It helps make sure everything goes well. First, we should think about eating healthy food and doing exercise. This helps our bodies be strong and ready for a baby, they explained. They also talked about going to the doctor before getting pregnant. Doctors can help us be healthy and check if everything is okay. It's like having a plan for a safe and happy pregnancy. The room was full of excitement and people were ready to use the new knowledge to get ready for having a baby. Embarking on the journey of pregnancy is a significant and exciting chapter in life. Planning ahead can enhance your chances of conceiving and ensure a healthy pregnancy. 1. Folic acid, the guardian nutrient. Ensuring a daily intake of folic acid is crucial even before conception. A 400 microgram supplement every day is recommended, providing protection against neural tube defects like spina bifida. In certain cases, a higher 5 mg dose may be advised, especially if there's a family history of such defects or if you have diabetes. 2. Smoking cessation, clearing the air for a healthy start. Quit smoking before and during pregnancy to minimize risks of premature birth, low birth weight, sudden infant death syndrome, SIDS, and miscarriage. Seek support from doctor, quit smoking for guidance on quitting, and create a smoke-free environment by asking friends and family not to smoke around you. 3. Alcohol abstinence, safeguarding your baby's well-being. Abstain from alcohol when trying to conceive or during pregnancy. Alcohol consumption can harm your unborn baby and increase the risk of long-term consequences. Prioritize your baby's health by eliminating alcohol from your lifestyle during this crucial time. 4. Weight management, striving for a healthy balance. Maintaining a healthy weight is pivotal for fertility and a successful pregnancy. Being overweight or obese may hinder conception and escalate the risk of complications. Aim for a balanced diet and moderate exercise to achieve a healthy weight. 5. Medication awareness, know what's safe. Understanding which medications are safe during pregnancy is essential. Consult with your doctor if you're on prescription medication, and never discontinue any medication without professional guidance. Be informed about the safety of over-the-counter drugs to make wise choices for your well-being and your baby's health. 6. Vaccination and infections, a shield against harm. Protect your baby from harmful infections by ensuring you're up to date with vaccinations. Check your immunity to diseases like rubella and consider vaccinations if needed. Plan pregnancies at least a month after the measles, mumps, and rubella (MMR) vaccine, employing reliable contraception during this period. 7. Long-term conditions and mental health, open conversations. If you have a long-term condition or mental health concerns, initiate open conversations with specialists or GPs before conceiving. Collaborate on a plan that considers your unique needs, ensuring a smooth journey through pregnancy, childbirth, and beyond. 8. Genetic screening, early insight for peace of mind. For individuals with ancestry from regions prone to blood disorders like sickle cell disease and thalassemia, genetic screening is vital. Testing before pregnancy offers valuable insights, allowing informed decisions about family planning. Your journey to parenthood is a unique adventure, and thoughtful planning can make it more fulfilling. Taking these steps sets the stage for a healthy pregnancy, ensuring you and your baby receive the best possible care from the very beginning. Timing is everything, unlocking the fertile window. To increase your chances of conception, aim to have intercourse during the 5 days leading up to ovulation or on the day of ovulation itself. This time frame is known as the fertile window. Monitoring changes in vaginal discharge, which becomes clear and slippery, can help pinpoint ovulation. Understanding your menstrual cycle length aids in determining when your fertile window occurs. Age and fertility, a crucial connection. A woman's age is a decisive factor in the journey to conception. Fertility gradually declines after the age of 32, accelerates at 35, and by 40, it's halved. While the impact of age on men's fertility is less drastic, men aged 45 and older experience reduced fertility. Additionally, older fathers may encounter a higher likelihood of certain health conditions in their offspring. Weight matters, striking a balance for fertility. Maintaining a healthy weight is essential for optimal fertility. Both being overweight and underweight can disrupt hormonal balance, affecting ovulation and fertility. Obese women tend to take longer to conceive and are at a higher risk of infertility. In men, obesity can also lower fertility, attributed to a combination of hormonal issues, erectile problems, and health conditions linked to excess weight. In the pursuit of parenthood, understanding the dynamics of timing, age, and weight empowers individuals and couples on their conception journey. By embracing this knowledge, you pave the way for a healthier and more informed approach to creating the next chapter of your lives. First trimester of pregnancy, weeks 1-12 conception to week 4 early development conception. The journey begins with the union of sperm and egg, forming a zygote. Week 3, fertilization occurs, creating a zygote. The blastocyst implants into the uterine lining. Week 4, the blastocyst develops into an embryo, about the size of a poppy seed. Weeks 5-8, formation of organs. Week 5, neural tube formation begins, and the heart starts beating. Week 6, limb buds appear, facial features develop, and the heart beats 110 times per minute. Week 7, bone and genital development, embryo termed fetus and the placenta forms. Week 8, organs and body systems develop, limbs form, and web-like hands and feet appear. Weeks 9-12, organ maturation. Week 9, teeth and taste buds form, muscles develop, and blood cells form in the liver. Week 10, fetus formation, with fingers and toes evolving and brain activity begins. Week 11, teeth bud, and the heart further develops. Week 12, fingers and toes become distinct, and the fetus is about 2.5 centimeters long. Precautions during the first trimester. Nutrition, focus on a balanced diet with sufficient folic acid, iron, and other essential nutrients. Avoid harmful substances, say no to alcohol, smoking, and recreational drugs. Medication, consult a healthcare provider before taking any medications. Hydration, drink plenty of water to stay well hydrated. Rest, ensure adequate rest and sleep. Necessary tests and checkups, confirmation test, pregnancy test to confirm pregnancy. Blood tests, to check blood type, Rh factor, and screen for infections. Ultrasound, usually done around week 8 to confirm the due date and check fetal development. Nuchal translucency screening, around week 11-14 to assess the risk of chromosomal abnormalities. First trimester combined screening test, blood test combined with an ultrasound to assess the risk of Down syndrome and other genetic conditions. Potential complications, miscarriage, common during the first trimester, often due to chromosomal abnormalities. Ectopic pregnancy, fertilized egg implants outside the uterus, usually in the fallopian tube. Hyperemesis gravidarum, severe nausea and vomiting leading to dehydration. Gestational diabetes, high blood sugar during pregnancy. Preeclampsia, high blood pressure and organ damage, usually in the second half of pregnancy. Diet and exercise during the first trimester. Diet, eating well is vital during the first trimester to provide essential nutrients for both mom and baby. Folic acid-rich foods include leafy greens, citrus fruits, and fortified cereals to support neural tube development. Iron-rich foods, consume lean meats, beans, and spinach to prevent anemia and support blood production. Calcium sources, ensure intake of dairy products, fortified plant-based milk, and leafy greens for bone health. Protein intake, include sources like eggs, poultry, tofu, and legumes for fetal tissue development. Hydration, drink plenty of water to stay hydrated, aiding digestion and maintaining amniotic fluid levels. Small, frequent meals, opt for smaller, more frequent meals to manage nausea and maintain energy levels. Exercise. Moderate exercise is generally safe and beneficial during the first trimester. Walking. Gentle walks are excellent for maintaining fitness without putting excessive strain on the body. Prenatal yoga. Yoga can help with flexibility, relaxation, and easing common pregnancy discomforts. Swimming. Low impact and refreshing. Swimming supports cardiovascular health without stressing joints. Pelvic floor exercises. Kegel exercises strengthen pelvic muscles, aiding in bladder control and preparation for labor. Consult with healthcare provider. Always check with a healthcare provider before starting or continuing any exercise routine. Precautions. Avoid high-impact activities and exercises that involve lying flat on your back after the first trimester. Listen to your body. If you feel discomfort, stop the activity. Stay well hydrated and wear appropriate clothing for comfort. Supplements. If required, prenatal vitamin supplements may be recommended to ensure adequate nutrient intake. Special considerations. If experiencing severe morning sickness, focus on staying hydrated and consult a healthcare provider for dietary adjustments. Second trimester week-by-week development. Week 13. Your body is now about the size of a lemon. Organs such as kidneys, intestines, and brain are forming. The tiny bones are beginning to harden. Fingernails and toenails are developing. Week 14, the baby's facial muscles are getting a workout as it starts making facial expressions. Hair is starting to grow on the scalp. Limbs can now move, and your baby may start sucking its thumb. Week 15, baby's ears are in the right place, and it can hear your voice. Muscles and bones are developing, and the baby is skiing and moving. The baby is now about the size of an apple. Week 16, the baby's skin is forming, but it's still translucent. You might start feeling those first gentle flutters of movement. Genitals are developing, and the baby is now the size of an avocado. Week 17, the baby is building fat stores and growing more hair. It's practicing sucking and swallowing movements. The placenta is providing nutrients, and the baby is about the size of a turnip. Week 18, baby's taste buds are forming. The nervous system is developing, and your baby is making more complex movements. The baby is now about the size of a sweet potato. Week 19, your baby's senses are developing. It can taste and hear. The baby might startle at loud noises. The baby is about the size of a mango. Week 20, you're halfway through. The baby is about the length of a banana. Hair is growing on the head. The baby's skin is less translucent, and it might start hiccuping. Week 21, the baby's eyebrows and eyelids are fully formed. It's gaining more weight and may be able to suck its thumb. The baby is about the size of a pomegranate. Week 22, the baby's organs are functioning, and it can hear your heartbeat. Eyelashes and eyebrows are growing. The baby is about the size of a coconut. Week 23, rapid brain growth is occurring. The baby is practicing breathing movements. It's about the size of a bunch of grapes. Week 24, the baby's lungs are developing, although they're not ready for breathing yet. It's starting to put on more weight with fat deposits. The baby is about the size of an ear of corn. Blood tests and scans in the second trimester. Blood tests. Quad marker screening, typically done around weeks 15-20. This blood test checks for markers associated with certain chromosomal abnormalities. Glucose screening, usually performed around week 24-28. Toe check for gestational diabetes. Complete blood count, CBC assesses your overall health and detects issues like anemia. Scans, anatomy ultrasound, 18-20 weeks. A detailed skin toe check the baby's growth, organs, and detect any abnormalities. Multiple marker screening, optional. This assesses the risk of neural tube defects, Down syndrome, and other chromosomal issues. Common pregnancy issues in the second trimester. Round ligament pain. As the uterus expands, you might feel sharp pains on the sides of your abdomen. Back pain. The growing belly can strain your back, causing discomfort. Swelling. Some swelling in the ankles and feet is common due to increased fluid retention. Braxton Hicks contractions. These are practice contractions that may be felt in the second trimester. Increased blood sugar levels can develop during this trimester. Heartburn. Hormonal changes can lead to stomach acid moving into the esophagus, causing heartburn. Increased vaginal discharge. Normal, unless it's accompanied by itching or a foul odor. Varicose veins. Increased blood flow can lead to swollen veins, especially in the legs. Regular checkups with your healthcare provider, a balanced diet, and staying hydrated can help manage and prevent some of these issues. Always consult your healthcare professional for personalized advice. Nutrition in the second trimester, a detailed guide. As you progress through the second trimester of pregnancy, proper nutrition becomes even more crucial to support the growth and development of your baby. Here's a detailed guide to the essential nutrients and a sample diet plan. 1. Protein. Why it's important. Supports the growth of baby's tissues and organs. Sources: lean meats, poultry, fish, eggs, dairy products, legumes, nuts, and seeds. Daily intake: aim for 71 grams per day. 2. Calcium. Why it's important. Critical for the development of your baby's bones and teeth. Sources: dairy products, fortified plant-based milk, green leafy vegetables, almonds. Daily intake: approximately 1,000 milligrams per day. 3. Iron. Why it's important. Prevents anemia and ensures proper oxygen supply to the baby. Sources: lean meats, beans, lentils, fortified cereals, spinach. Daily intake: around 27 milligrams per day. 4. Folate. Why it's important. Vital for preventing neural tube defects in the baby. Sources: dark green leafy vegetables, citrus fruits, fortified cereals, beans. Daily intake: about 600 micrograms per day. 5. Omega-3 fatty acids. Why it's important. Supports baby's brain and eye development. Sources: fatty fish, salmon, trout, chia seeds, flax seeds, walnuts. Daily intake: aim for at least 200 milligrams of DHA. 6. Vitamin D. Why it's important. Helps in the absorption of calcium for bone development. Sources: sunlight exposure, fortified dairy or plant-based milk, fatty fish. Daily intake: around 600 IU, international units, per day. 7. Vitamin C. Why it's important. Aids in the absorption of iron from plant-based sources. Sources: citrus fruits, strawberries, bell peppers, tomatoes. Daily intake: approximately 80-85 milligrams per day. 8. Fiber. Why it's important. Prevents constipation, a common issue during pregnancy. Sources: whole grains, fruits, vegetables, legumes, nuts, and seeds. Daily intake: aim for 25-30 grams per day. Sample diet plan: breakfast, scrambled eggs with spinach and whole grain toast. Greek yogurt with berries. Lunch: grilled chicken or chickpea salad with mixed vegetables. Quinoa or brown rice on the side. Snack: handful of almonds or walnuts. Fresh fruit, like an apple or a banana. Dinner: baked salmon or a tofu stir-fry with broccoli and carrots. Sweet potato or whole grain pasta. Snack: if needed, carrot sticks with hummus. Low-fat cottage cheese with pineapple. Remember, it's crucial to stay hydrated by drinking plenty of water throughout the day. Additionally, consult with your healthcare provider or a registered dietitian for personalized advice based on your specific needs and health conditions. It's important to be aware of certain precautions and red flags during the second trimester of pregnancy. Regular prenatal checkups. Continue attending regular prenatal checkups. These appointments are crucial for monitoring the health of both you and your baby. Monitor blood pressure. Keep an eye on your blood pressure. High blood pressure during pregnancy, known as gestational hypertension, can lead to complications. Gestational diabetes screening. Between weeks 24 and 28, you'll likely be screened for gestational diabetes. Proper management of this condition is essential for both you and the baby's well-being. Fetal movement. Pay attention to your baby's movements. A noticeable decrease in fetal activity could be a sign of potential issues, and you should contact your healthcare provider. Vaginal bleeding. Any unexplained vaginal bleeding should be reported to your healthcare provider immediately, as it may indicate a problem. Severe abdominal pain. Severe abdominal pain, especially if accompanied by other symptoms like fever, should be addressed promptly. Persistent headaches or vision changes. These could be signs of conditions like preeclampsia, and they require immediate medical attention. Swelling. While some swelling is normal, sudden or severe swelling in the hands, face, or legs may be a cause for concern. Signs of preterm labor. Watch for signs such as regular contractions before 37 weeks, abdominal cramping, or a change in vaginal discharge. These may indicate preterm labor. Infections. Be cautious about infections. Any signs of urinary tract infections, yeast infections, or other infections should be reported to your healthcare provider. Remember, your healthcare provider is your best resource for personalized advice based on your health and pregnancy. If you experience any of these red flags or have concerns, don't hesitate to reach out to them promptly. It's important to stay active during pregnancy, but it's equally crucial to choose exercises that are safe and beneficial. Here's a detailed exercise plan for the second trimester, along with exercises to avoid. Exercise plan for second trimester. Cardiovascular exercise. Recommended activities: walking, swimming, stationary cycling. Duration: aim for at least 150 minutes of moderate intensity exercise per week, spread throughout the week. Intensity: maintain a moderate intensity. You should be able to talk comfortably while exercising. Strength training. Recommended activities: prenatal yoga, Pilates, low-impact weight training. Focus: strengthening core muscles, legs, and upper body. Avoid heavy weights and focus on higher reps with lighter weights. Pelvic floor exercises. Recommended activities: Kegel exercises to strengthen pelvic floor muscles. Frequency: perform Kegels throughout the week to support pelvic health. Flexibility and stretching. Recommended activities: prenatal yoga, stretching exercises. Focus on gentle stretches to improve flexibility and reduce muscle tension. Pelvic tilt exercises. Recommended activities: pelvic tilts to strengthen abdominal muscles. How to do: stand with your back against a wall, tighten your abdominal muscles, and press the small of your back against the wall. Hold for a few seconds and release. Exercises to avoid: high-impact activities. Avoid exercises that involve jumping or sudden, jarring movements, as these may strain your joints and pelvic floor. Supine exercises after the first trimester. Avoid lying flat on your back for extended periods after the first trimester, as this can compress the vena cava, reducing blood flow to the uterus. Heavy weightlifting. Avoid lifting heavy weights that could strain your back and abdomen. Focus on lighter weights with higher repetitions. Exercises requiring balance. Be cautious with exercises that require a significant sense of balance, especially as your center of gravity shifts. Hot yoga or exercise in hot environments. Avoid activities that can lead to overheating. Opt for cooler environments and stay well hydrated. Contact sports. Avoid activities with a risk of abdominal trauma or falls, such as contact sports. Always listen to your body, stay hydrated, and modify exercises as needed. If you have any pre-existing health conditions or concerns, consult with your healthcare provider before starting or continuing any exercise routine during pregnancy. Let's look at the progress of the fetus week by week during the third trimester. Week 28, size. Your baby is about 1 kg, 2 pounds 2 ounces, and measures about 25 cm, 10 inches, from crown to rump. Development: the baby's eyelids, previously fused, separate into upper and lower lids. It can now open and shut its eyes. Fine hair, lanugo, covers the skin, and a waxy coating, vernix, protects it. The baby starts making breathing movements with its developing lungs. Week 32, size. Your baby continues to grow and is now around 33 centimeters in length. Development: the baby spends most of its time asleep but has strong and coordinated movements. It likely assumes the head down position, getting ready for birth. Week 36, size. the baby is around 46 centimeters in length. Development, the baby has probably nestled its head into your pelvis, preparing for birth. If born now, its chances for survival are excellent. The development of the lungs is rapid. Week 40, size, your baby is around 51 centimeters in length and ready to be born. Development, the baby is fully developed and considered full-term. The exact trigger for labor is unknown, but a combination of physical, hormonal, and emotional factors between you and the baby initiates the process. These weeks mark a crucial period when the baby is fine-tuning its development and preparation for life outside the womb. Each week brings the baby closer to being ready for the journey of birth. It's crucial for both the mother's health and the baby's development. Here's a detailed look at the nutrition requirements along with a sample diet plan. Caloric intake, aim for an additional 300-500 calories per day to support the growing baby and maintain your energy levels. Proteins, essential for the baby's growth and development, include lean meats, poultry, fish, eggs, dairy products, beans, lentils, and nuts in your diet. Calcium, important for the baby's bone development. Include dairy products, leafy green vegetables, tofu, and fortified plant-based milk. Iron, prevents anemia and ensures proper oxygen supply to the baby. Consume lean meats, poultry, fish, iron-fortified cereals, and dark leafy greens. Folate, crucial for preventing neural tube defects in the baby, include leafy greens, citrus fruits, beans, and fortified grains. Fiber, helps with digestion and prevents constipation. Eat whole grains, fruits, vegetables, and legumes. Omega-3 fatty acids, important for the baby's brain and eye development. Include fatty fish, like salmon, flax seeds, chia seeds, and walnuts. Vitamin D, essential for calcium absorption and bone health, get sunlight exposure and include vitamin D-rich foods like fortified milk and fish. Sample diet plan, breakfast, whole grain cereal with milk and sliced strawberries. A boiled egg. Mid-morning snack, Greek yogurt with a handful of almonds. Lunch, grilled chicken or tofu salad with mixed greens, tomatoes, and quinoa. A side of steamed broccoli. Afternoon snack, sliced apple with peanut butter. Dinner, baked salmon or lentil curry. Sweet potato and sautéed spinach. Evening snack, whole grain crackers with cheese. Hydration, drink plenty of water throughout the day to stay hydrated. Precautions, avoid excessive caffeine. Limit added sugars and processed foods. Consult with your healthcare provider about any specific dietary restrictions or supplements. Ensuring a well-balanced diet with a variety of nutrient-rich foods is vital for a healthy pregnancy in the third trimester. Always consult with your healthcare provider for personalized advice based on your specific health needs. During the third trimester, it's essential to pay close attention to your health and be aware of potential red flags. Here are some precautions and warning signs that warrant immediate attention. Regular checkups. Continue with regular prenatal checkups to monitor the baby's growth and your health. Discuss any concerns or unusual symptoms with your healthcare provider. Kit counts. Monitor your baby's movements daily. Report any significant decrease in fetal movement to your healthcare provider. Proper hydration. Stay well hydrated to prevent dehydration, which can lead to contractions and preterm labor. Rest and sleep. Ensure adequate rest and sleep. Fatigue can contribute to stress on the body. Pelvic rest. If advised by your healthcare provider, practice pelvic rest, which may include avoiding sexual intercourse and certain physical activities. Breast health. Be mindful of changes in breast tenderness, size, or lumps. Report any unusual findings. Blood pressure monitoring. Regularly check your blood pressure. High blood pressure can lead to complications such as preeclampsia. Red flags. Severe abdominal pain. Intense or persistent abdominal pain could indicate conditions like placental abruption or preterm labor. Vaginal bleeding. Any amount of vaginal bleeding should be reported immediately, as it can signal various complications. Severe headaches or visual changes. Persistent and severe headaches or changes in vision could be signs of conditions like preeclampsia. Swelling, sudden or severe swelling in the hands, face, or legs may indicate a problem and should be reported. Significant weight gain or loss. Rapid weight gain or loss could be a sign of fluid retention, gestational diabetes, or other issues. Chills or fever. Persistent chills or a fever may indicate an infection, which can pose risks during pregnancy. Reduced fetal movement. A noticeable decrease in your baby's movements requires immediate attention. Difficulty breathing. Difficulty breathing, especially when atreused, could be a sign of complications. Remember, any unusual or concerning symptoms should be reported promptly to your healthcare provider. It's crucial to maintain open communication and seek medical advice if you have any doubts about your health or the health of your baby. Exercise plan for third trimester. Exercising during the third trimester can help maintain your strength, flexibility, and overall well-being. Always consult with your healthcare provider before starting or continuing any exercise routine. Here's a suggested plan. Walking. Engage in brisk walking for at least 20-30 minutes most days of the week. Choose flat and well-lit surfaces to reduce the risk of falling. Swimming. Enjoy swimming or water aerobics to alleviate joint and back strain while providing a full-body workout. Prenatal yoga. Attend prenatal yoga classes focusing on gentle stretches, breathing exercises, and relaxation techniques. Pelvic floor exercises. Perform Kegel exercises to strengthen pelvic floor muscles, aiding in labor and postpartum recovery. Pilates. Consider prenatal Pilates to enhance core strength and improve posture. Low-impact aerobics. Participate in low-impact aerobics classes designed for pregnant women. Stationary cycling. Use a stationary bike to minimize impact in joints while maintaining cardiovascular fitness. Strength training. Incorporate light resistance training for major muscle groups, focusing on proper form and breathing. Stretching. Emphasize gentle stretching exercises to maintain flexibility and reduce muscle tension. Exercises to avoid. High-impact activities. Avoid high-impact exercises like running or jumping, as they may strain joints and increase the risk of injury. Supine exercises. Refrain from exercises that require you totally flat on your back for an extended period, especially after the first trimester. Heavy weightlifting. Steer clear of heavy weightlifting that puts excessive strain on your back and abdomen. Contact sports. Avoid contact sports or activities with a risk of falling, such as skiing or horseback riding. Exercises on your back. After the first trimester, avoid exercises that involve lying flat on your back for an extended period, as it may reduce blood flow to the uterus. Hot yoga or hot Pilates. Skip exercises in overly hot environments to prevent overheating. Excessive twisting. Minimize exercises involving excessive twisting of the torso to protect your spine. Always listen to your body, stay hydrated, and modify or stop any exercise that causes discomfort. If you experience dizziness, shortness of breath, chest pain, vaginal bleeding, or contractions during exercise, seek medical attention immediately. Here's an overview of different delivery methods. Normal vaginal delivery, NVD benefits, natural and less invasive. Shorter recovery time for the mother. Lower risk of infection and complications. Promotes early bonding between mother and baby. Side effects. Vaginal tearing or episiotomy, a surgical cut to enlarge the vaginal opening. Pain and discomfort during the process. Longer labor duration for some. Assisted vaginal delivery, AVD benefits, assists in cases where the mother is too exhausted to push. Shortens the delivery time. Reduces the need for a C-section. Side effects, risk of maternal and fetal injuries. Increased likelihood of episiotomy. Bruising or swelling of the baby's head. Cesarean section, C-section benefits, necessary in emergencies to prevent complications. Planned C-sections may be recommended for certain medical reasons. Reduced risk of birth injuries in cases of a difficult delivery. Side effects, longer recovery time for the mother. Surgical risks such as infection or blood loss. Potential breathing difficulties for the baby. Water birth, benefits, buoyancy in water reduces pressure on the mother's abdomen. Relaxation and pain relief. Less need for medical interventions. Side effects: risk of infection if the water is not properly maintained. Limited access to medical monitoring. Potential for the baby to inhale water. VBAC, vaginal birth after cesarean benefits, avoids the potential complications of repeated C-sections. Shorter recovery time compared to C-section. Side effects: risk of uterine rupture, although rare. Potential for emergency C-section during labor. Vaginal tearing or other complications. Induced labor, benefits, necessary in cases of medical conditions or post-term pregnancies. Reduces the risk of complications associated with prolonged pregnancies. Side effects: stronger and more painful contractions. Increased risk of interventions like C-section. Fetal distress due to the rapid onset of labor. It's essential to discuss delivery options with your healthcare provider to determine the most suitable method based on your health, the baby's well-being, and any existing medical conditions. Each delivery method has its unique set of benefits and potential risks, and the choice often depends on individual circumstances. When a couple is expecting a baby and living alone, it's essential for both partners to work together and create a supportive environment. Here's advice for both partners. For the expecting mother: self-care, prioritize your health and well-being. Get adequate rest, eat nutritious meals, and stay hydrated. Share your thoughts, feelings, and any concerns with your partner. Open communication fosters understanding and support. Delegate tasks. Don't hesitate to delegate tasks to your partner. Share responsibilities around the house, especially if you're experiencing fatigue or discomfort. Prenatal appointments. Attend prenatal appointments together. This involvement helps both partners stay informed about the pregnancy and the health of the baby. Express needs. Clearly communicate your needs. Whether it's a foot rub, some quiet time, or help with household chores, let your partner know how they can support you. For the partner, educate yourself, learn about the stages of pregnancy, common symptoms, and what to expect during labor. This knowledge will help you provide better support. Be attentive, pay attention to your partner's needs and emotions. Offer a listening ear and be present during moments when they may need extra support. Assist with chores, take an active role in household chores. This includes cooking, cleaning, and other tasks that can become challenging for the expecting mother. Attend classes together. If there are prenatal classes available, consider attending them together. This can enhance your understanding of the birthing process and postpartum care. Create a relaxing environment. Help create a calm and relaxing environment at home. This can involve setting up a comfortable space for the mother, practicing relaxation techniques, or planning enjoyable activities together. Plan for the future. Discuss and plan for the future as a family. This includes considerations like parental leave, dividing responsibilities after the baby arrives, and creating a supportive network. Celebrate milestones. Celebrate pregnancy milestones together. Whether it's the first ultrasound or feeling the baby kick, these moments are significant and should be shared. Remember, every pregnancy is unique, and the key is to adapt and support each other as a team. Regularly check in with one another, adjust plans as needed, and celebrate the journey of becoming parents together. Once upon a time, there was a new mom named Emma, and she had a beautiful baby named Lily. Emma learned about the magic of breastfeeding and all the wonderful things it could do for Lily. In the land of nutrition, Emma discovered that breast milk was like a magical potion specially made for Lily. It had all the right ingredients to help Lily grow strong and healthy. Lily's tummy loved it because it was easy to digest, and Emma didn't have to worry about preparing bottles. Health adventures. Lily became a little superhero with a boosted immune system. Thanks to the magical breast milk, she was protected from nasty illnesses and infections. Emma was so happy that Lily had fewer allergies too. Mom and baby bonding. As Emma and Lily snuggled close during feedings, they felt a special bond growing between them. Breastfeeding wasn't just about food, it was also about love and comfort. Lily found solace in her mom's warm embrace. Economic magic. Emma realized that breastfeeding was not only magical but also cost-free. No need to buy expensive formula. Lily had her magic milk always ready. Emma loved the convenience of not having to prepare bottles, making life a bit easier. Long-term enchantment, as Lily grew, so did the benefits of breastfeeding. Some whispered tales even spoke of a higher IQ for breastfed babies. Emma dreamed of Lily having a healthy future with a lower risk of chronic diseases. Breastfeeding tips, the wise guide. One day, Emma learned the secrets of a good latch. She made sure Lily had a wide latch and found a comfy position for their feeding adventures. Lily fed on demand, and Emma embraced the rhythm of frequent feedings. Emma knew that maintaining her health was crucial. She feasted on a healthy diet and drank plenty of water to keep the magic flowing. Whenever challenges arose, Emma sought guidance from midwife and joined support groups for encouragement. For times when Lily couldn't be with Emma, they discovered the art of expressing milk. Emma learned to use a magical pump to store milk for Lily, introducing her to the wonders of bottle feeding. Throughout their breastfeeding journey, Emma and Lily faced challenges. Yet, with patience and a cozy environment, they overcame every hurdle. Their story became one of shared moments, love, and the magic of breastfeeding in the enchanting land of motherhood. And so, their tale continued, filled with the warmth and nourishment of a mother's love. Once upon a time, Emma, a new mom, embarked on her postpartum journey after welcoming her adorable daughter, Lily. Restful nights, Emma's plan was simple: get plenty of rest. With a baby in the house, sleep was a treasure. Her advice to herself? Whenever Lily napped, Emma joined in for a bit offers too. Handling the pain, C-sections come with a bit of pain, but Emma had a plan. She took the pain meds her doctor prescribed, making sure to stay ahead of any discomfort. Her advice to others? Don't tough it out, medication can be a friend. Gentle healing for the incision. Given Emma's C-section, caring for her incision was crucial. She made a routine of keeping it clean and dry, just as her healthcare provider recommended. Her advice? Follow the doctor's instructions like a map, they lead to healing. A wholesome diet. Emma's plan included a balanced diet, fruits, veggies, proteins, and grains. Hydration was key, especially since she was breastfeeding. Her advice echoed through the kitchen: eat well and drink up. Healthy habits. Hygiene was in Emma's playbook. Clean hands were a must, especially before handling Lily. Her advice: make handwashing a ritual in this new chapter of life. Stepping into exercise. Emma decided to ease into exercise, starting with walks. She gradually added more activities. Her advice? Listen to your body and take it one step at a time. Caring for the mind. Postpartum emotions were real for Emma. She put her mental health on the priority list, seeking support from family and friends. Her advice? Don't be shy, talk about those feelings. Checkup dates. Postpartum checkups were circled on Emma's calendar. Attending them was part of the plan. Her advice? Keep those appointments, they're like checkpoints in your recovery journey. Family planning conversations. Family planning was a topic Emma didn't shy away from. Discussing birth control options with her healthcare provider was on her plan. Her advice? Have that conversation, it's part of the postpartum puzzle. Breastfeeding bond. Breastfeeding became Emma and Lily's special time. Emma aimed for a routine and sought help from lactation consultants when needed. Her advice to fellow moms: don't hesitate to ask for guidance. Scar watch. Keeping an eye on her C-section scar was Emma's habit. Any red flags, and she knew to call her doctor. Her advice? Don't ignore changes, report them. Pelvic power. Pelvic floor exercises became a part of Emma's routine. She knew they were like superheroes aiding her recovery. Her advice? Strengthen those muscles, they're your rallies. Connecting with others. Emma joined mom support groups, connecting with others on the same journey. Her advice? Share your experiences, it's a community. Stay informed. Emma stayed informed about postpartum changes, educating herself on what to expect. Her final advice: knowledge is your guide through this adventure. Emma, a diligent new mom, understood the importance of recognizing red flags during her postpartum period. She kept an eye out for these signals, ensuring her health and well-being. Excessive pain. Emma knew that some pain after childbirth was normal, especially if she had a C-section. However, if the pain became unbearable or if she noticed any unusual swelling, she considered it a red flag. Her mantra? Pain that feels beyond the norm deserves attention. Persistent bleeding. Postpartum bleeding is typical, but Emma was cautious about its duration. If the bleeding seemed excessive or persisted longer than advised, it was a signal to call her healthcare provider. Her advice? Listen to your body and report anything unusual. Emotional distress. While a mix of emotions is expected, Emma was aware of the signs of postpartum depression or anxiety. If persistent sadness, anxiety, or mood swings became overwhelming, she considered it a red flag and reached out for support. Her wisdom? Mental health is as crucial as physical health. Fever or chills. Emma understood that fever or chills could be signs of infection. If her body temperature soared or if she experienced uncontrollable shivering, it was a red flag waving urgently. Her advice? Don't ignore these signs. Prompt action is key. Trouble breathing. As a mom recovering from childbirth, Emma paid attention to her respiratory well-being. If she experienced persistent shortness of breath or any breathing difficulties, she knew it was a red flag. Her reminder? Breathing should be steady. Consult if it feels otherwise. Unusual discharge. Vaginal discharge is normal postpartum, but Emma knew when it crossed the line. If the discharge had a foul odor, unusual color, or consistency, she considered it a red flag for possible infection. Her tip? Trust your instincts and report any deviations. Severe headaches or visual changes. Emma was vigilant about her postpartum headaches. If they became severe or were accompanied by changes in vision, she recognized it as a red flag. Her guidance? Headaches beyond the usual spectrum need professional attention. Emma was attuned to changes in her breasts. If she noticed redness, heat, or persistent pain, especially in one breast, it was a red flag for possible mastitis, an inflammation she wouldn't ignore. Her counsel? Breast health matters. Address concerns promptly. Abdominal pain or swelling. Knowing that abdominal pain and swelling could indicate various concerns, Emma considered them red flags if they intensified or lingered. Her rule? Report any unusual abdominal discomfort without hesitation. Urinary or bowel issues. Emma monitored her urinary and bowel functions. Any difficulties or persistent discomfort in these areas were marked as red flags. Her suggestion? Changes here might signal underlying issues. Consult with your healthcare provider. Emma navigated her postpartum journey with a keen eye for these red flags. She encouraged fellow moms to trust their instincts, recognize warning signs, and seek professional guidance when needed. After all, a vigilant approach ensures a smoother transition into this new chapter of motherhood. Emma loved Lily a lot, and every day was filled with baby giggles and songs. But as the days went by, Emma started feeling a bit different. Even though Lily was adorable, Emma felt a bit sad inside. It was like a gray cloud over her happiness. Emma's worries got louder. Nighttime feedings and lack of sleep made her tired, and normal things felt too hard. Lily's cries, which used to be cute, now made Emma feel overwhelmed. Emma began to stay away from friends and family. Her colorful life now seemed dull. Even though Emma smiled, she felt lost inside. Emma felt guilty. She wondered why she couldn't be as happy as others. Lily sensed her mom's sadness and created a special bond with her. One day, Emma bravely shared her feelings with a friend. Talking about it felt like a bit of light in the darkness. Emma learned she wasn't alone, and others felt the same. Emma talked to a doctor who knew a lot about postpartum depression. The doctor was kind and explained that what Emma was going through was quite common. Emma started a journey to feel better. Through therapy and talking with other moms, Emma found ways to cope. Sometimes, medicine helped too. Lily, too young to understand, became Emma's little source of strength. As Emma got better, Lily became even more special. The love between them helped Emma heal. Emma realized that asking for help wasn't weak, it was a brave thing to do. Emma started a journey to feel better. Through therapy and talking with other moms, Emma found ways to cope. Sometimes, medicine helped too. Lily, too young to understand, became Emma's little source of strength. With time, Emma started feeling happy again. Lily's laughter brought joy back into their lives. The town of Serenity changed too, becoming a place where everyone supported moms like Emma. Emma and Lily's story showed that postpartum depression is just a chapter. With love, support, and courage, Emma found her way back to happiness. Their story became a light of hope for others in Serenity, proving that, even in the darkest times, love can show the way. Let's dive into a detailed diet plan and advice for weight loss after pregnancy. Morning, breakfast, start your day with a balanced meal. Try oatmeal with sliced fruits or whole grain toast with peanut butter. Don't forget a glass of water or a cup of tea. Mid-morning snack, grab a healthy snack like Greek yogurt with a handful of nuts or an apple with cheese. Stay hydrated with water or herbal tea. Lunch, opt for grilled chicken or fish with quinoa or brown rice and a colorful mix of veggies. Include a side salad with a variety of greens. Drink water or have a cup of low-fat milk. Afternoon snack, enjoy a protein smoothie with your favorite fruits or a handful of baby carrots with hummus. Keep yourself hydrated with water or a refreshing herbal tea. Dinner, focus on a well-rounded dinner with lean protein, chicken, tofu, or beans, whole grains, barley, bulgur, and a mix of steamed or roasted vegetables. Include a side of salad or steamed greens. Drink water or have a cup of warm herbal tea. Evening snack, if you're hungry before bedtime, consider a small bowl of Greek yogurt with a sprinkle of granola or a piece of fruit. Hydrate with water or a cup of chamomile tea. General tips: stay hydrated, drink plenty of water throughout the day. It helps with weight loss and keeps you energized. Portion control, be mindful of portion sizes. Listen to your body when it signals fullness. Include nutrient-rich foods, prioritize whole foods like fruits, vegetables, lean proteins, and whole grains. Moderation is key, treat yourself occasionally, but keep treats in moderation. Physical activity, include gentle exercises like walking, postnatal yoga, or swimming as your body allows. Consult a professional, talk to a nutritionist or your healthcare provider for personalized advice. Remember, the goal is to nourish your body while gradually losing weight. Every person is unique, so tailor this plan to fit your preferences and lifestyle. If you have specific dietary needs or concerns, seek advice from a healthcare professional or a registered dietitian. Let's break down a detailed exercise plan and advice for weight loss after pregnancy. Exercise plan: walking, duration, start with 15-20 minutes and gradually increase. Frequency, aim for at least 3-4 times a week. Advice: take your baby for a stroll, it's a great bonding activity. Postnatal yoga, duration, begin with 15-20 minutes and extend as you feel comfortable. Frequency, 2-3 times a week. Advice: focus on gentle poses that improve flexibility and strength. Bodyweight exercises, squats, lunges, pelvic tilts, and Kegel exercises. Duration, start with 10-15 repetitions, gradually increasing. Frequency, 3 times a week. Advice: strengthening these areas aids in overall fitness. Swimming, duration, 20-30 minutes per session. Frequency, once or twice a week. Advice: provides a low-impact full body workout. Pelvic floor exercises, Kegels and pelvic tilts. Duration, 5-10 minutes daily. Advice: vital for postpartum recovery and strengthening core muscles. Cardio workouts, activities, low-impact aerobics, stationary cycling. Duration, 20-30 minutes. Frequency, 3 times a week. Advice: gradually increase intensity as your stamina improves. General tips: listen to your body, pay attention to how your body responds to exercise. Start slow and progress gradually. Stay hydrated, drink water before, during, and after your workout. Include rest days, allow your body time to recover. Rest is crucial for overall well-being. Involve your baby, if possible, include your baby in exercises. It can be fun and practical. Consult a professional. Before starting any exercise program, consult with your healthcare provider. Prioritize posture. Maintain good posture during exercises to prevent strain on your back and joints. Pelvic floor checks. Regularly engage in pelvic floor assessments to ensure proper recovery. Remember, the key is consistency and patience. Gradual progress is healthier and more sustainable. If you have specific concerns or health conditions, seek advice from a healthcare professional or a certified fitness expert. Emma, a caring and knowledgeable mom, was passionate about providing the best care for her newborn, Lily. Here's a glimpse into her expert advice and infant care plan, shared with warmth and simplicity. Gentle bathing rituals. For Emma, bath time was a special bonding moment. She emphasized using lukewarm water and mild baby soap. Gentle strokes and soft towels are key, she'd say, making it a soothing experience for both baby and mom. Cuddles and comfort. Never underestimate the power of cuddles, Emma smiled. Holding Lily close, she explained the importance of skin-to-skin contact. It's not just about warmth, it builds a strong connection and reassures your little one. Nourishment know-how. As a nutrition-savvy mom, Emma stressed the significance of breastfeeding. Nature's perfect food, she called it. She advised new moms to be patient, ensuring a comfortable and quiet environment for feeding. Sleep routines. Emma believed in establishing a gentle sleep routine. Consistency is key, she advised. Creating a calming bedtime ritual and keeping the sleep environment comfortable helped Lily understand when it was time to rest. Diapering delicacies. Diaper changes are an art, Emma chuckled. She recommended keeping the changing area well stocked, using gentle wipes, and ensuring the diaper fits snugly. It's not just about hygiene, it's a chance for play and giggles too. Soothing the tears. When Lily cried, I learned to listen, Emma shared. She suggested checking for hunger, discomfort, or tiredness. Sometimes, all they need is a comforting lullaby or a gentle sway, she winked. Health and wellness wisdom. Emma's approach to health was holistic. Regular checkups, vaccinations on schedule, and creating a baby-friendly environment were paramount. A healthy baby is a happy baby, she affirmed. Stimulating playtime. Play is how they explore the world, Emma noted. She introduced colorful toys, soft books, and tummy time. Engaging their senses from the beginning fosters curiosity and development. Baby-proofing the nest. Safety was a priority in Emma's care plan. Baby-proofing isn't just about corners and sockets, she explained. It's creating a space where Lily can explore safely as she grows. Trusting maternal instincts. Above all, Emma championed the power of maternal instincts. You know your baby best, she encouraged. Trust your gut, ask for help when needed, and savor every moment. Emma's expert infant care plan wasn't just a routine, it was a journey of love, learning, and shared joy. Her advice resonated with new moms, making the adventure of caring for a newborn a beautiful and fulfilling experience. Every parent wants to create a safe haven for their little one, shielding them from any harm. Emma, a seasoned mother, understood the significance of recognizing red flags, especially when it came to sudden infant death syndrome, SIDS. Safe sleep practices. Emma stressed the importance of creating a safe sleep environment. Always place your baby on their back to sleep, she emphasized. A firm mattress, no soft bedding, and avoiding overheating were crucial components of her safety protocol. Monitoring breathing patterns. Keep an eye on your baby's breathing, Emma advised. While some variations are normal, consistent irregularities could be a red flag. Emma suggested investing in a baby monitor to keep a watchful eye, providing peace of mind to parents. Recognizing warning signs. Emma was adamant about knowing the signs of distress. Persistent coughing, wheezing, or difficulty breathing should never be ignored, she noted. Timely intervention and consulting a healthcare professional were non-negotiable in her book. Consistent check-ins. Regularly check on your baby during naps and nighttime, Emma recommended. Even with a reliable baby monitor, she believed in the reassurance that came from physically peeking in and ensuring the little one was sleeping soundly. Vaccination vigilance. Emma was an advocate for vaccination. Follow the recommended schedule, she urged. Keeping vaccinations up to date not only protected against preventable illnesses but also contributed to overall well-being. Maintaining optimal temperature. Overheating was a red flag on Emma's radar. Dress your baby in layers so you can adjust as needed, she suggested. Maintaining a comfortable room temperature was key, reducing the risk of SIDS. Tummy time supervision. While Emma valued tummy time for development, she stressed the need for supervision. Always be there when your baby is on their tummy, she insisted. This allowed for exploration while minimizing the risk of accidental mishaps. Responding to concerns. Don't hesitate to seek help, Emma encouraged. If a parent had any concerns or noticed changes in their baby's behavior, seeking advice from a healthcare professional was crucial. Emma believed in addressing issues promptly. Co-sleeping cautions. Emma was cautious about co-sleeping. While it's tempting, it's safest for babies to sleep in their own crib, she advised. Co-sleeping could pose risks, and Emma preferred erring on the side of caution. Trusting instincts. Lastly, Emma championed parental instincts. If something doesn't feel right, act on it, she affirmed. A parent's intuition often picked up on subtle cues that warranted attention. Understanding red flags and being vigilant against SIDS was Emma's way of fostering a secure and nurturing environment for her child. Her wisdom resonated with other parents, creating a community of caregivers committed to the safety and well-being of their precious little ones. As an experienced parent, Emma knew the challenges that could arise when dealing with a fussy, colicky baby. She understood the importance of addressing issues like colic and constipation with a gentle and informed approach. Soothing colic woes. Emma vividly remembered the sleepless nights with her own little one dealing with colic. Gentle rocking and carrying your baby can work wonders, she advised. Colic often eased with movement, providing comfort to the distressed baby. Massage magic. Emma was a firm believer in the power of baby massage. A gentle tummy massage in a clockwise motion can aid digestion and alleviate colic symptoms, she shared. The warmth of a parent's touch often brought relief to the gassy discomfort. Optimal feeding techniques. Emma emphasized the significance of feeding techniques. Ensure a proper latch during breastfeeding, or choose an anti-colic bottle if you're bottle feeding, she suggested. Addressing swallowing air during feeds could minimize colic episodes. Probiotics for comfort. Probiotics became a secret weapon in Emma's parenting arsenal. Consult your pediatrician about introducing probiotics to your baby's routine, she recommended. Probiotics could contribute to a healthier gut and alleviate colic symptoms. Consistent feeding schedule. Establishing a consistent feeding schedule was Emma's go-to strategy. Feed your baby at regular intervals to prevent hunger-related fussiness, she advised. Predictability often helped in managing colic episodes more effectively. Hydration for constipation woes. Constipation was another challenge Emma navigated. Ensure your baby stays hydrated, she stressed. Whether breastfeeding or formula feeding, ample fluids were crucial for maintaining healthy bowel movements. Tummy time for digestion. Tummy time wasn't just for play, Emma knew its digestive benefits. Incorporate tummy time into your daily routine to promote better digestion and alleviate constipation, she recommended. It encouraged movement that could stimulate the digestive system. Fiber-rich introductions. As solid foods made their debut, Emma advised incorporating fiber-rich options. Prunes, pears, and peas can be gentle introductions to alleviate constipation, she suggested. Gradual dietary changes often had a positive impact. Bicycle leg movements. Emma swore by the simplicity of bicycle leg movements. Gently move your baby's legs in a cycling motion to ease gas and promote bowel movements, she shared. The rhythmic motion could offer relief to a constipated baby. Seeking professional guidance. For persistent colic or constipation concerns, Emma was adamant about seeking professional advice. Your pediatrician is your ally in ensuring your baby's well-being, she affirmed. Timely consultations could address underlying issues and provide tailored solutions. Emma's journey through colic and constipation wasn't without its challenges, but her thoughtful strategies and expert guidance resonated with other parents facing similar concerns. Her wisdom became a source of comfort, creating a supportive community of caregivers navigating the intricacies of infant care with compassion and knowledge. In the realm of infant care, Emma knew that nappy rash could be a common hurdle for parents. As an experienced caregiver, she shared her expert advice through relatable stories and practical tips. Gentle diaper changes. Emma emphasized the importance of gentle diaper changes. Avoid rubbing or scrubbing during changes, she advised. Patting the baby's skin dry and allowing some air exposure helped prevent and soothe nappy rash. Choosing the right diapers. Selecting the right diapers was a crucial step in Emma's playbook. Opt for diapers with breathable materials to reduce moisture, she recommended. Good ventilation could contribute to keeping the baby's skin dry and healthy. Mindful cleansing routine. Emma's cleansing routine was all about mindfulness. Use a mild, fragrance-free cleanser during diaper changes, she suggested. Harsh chemicals and fragrances could irritate delicate skin, leading to nappy rash. Diaper-free time. Emma was an advocate for diaper-free time. Allow your baby's skin to breathe for short periods, she shared. Providing moments of freedom from diapers promoted airflow and minimized the risk of rash. Protective barrier creams. Emma's go-to solution for preventing nappy rash was a reliable barrier cream. Apply a thin layer of a gentle barrier cream with each diaper change, she recommended. It acted as a protective shield against moisture and irritation. Regular diaper checks. Being vigilant was a cornerstone of Emma's nappy rash prevention strategy. Regularly check for wetness or irritations, she advised. Timely diaper changes prevented prolonged exposure to dampness. Comfortable diaper fit. Emma stressed the importance of a comfortable diaper fit. Ensure the diaper isn't too tight or too loose, she suggested. A well-fitted diaper minimized friction and provided comfort to the baby. Fragrance-free wipes. When it came to wipes, Emma had a clear preference. Choose fragrance-free, hypoallergenic wipes for sensitive skin, she recommended. Gentle cleansing without added irritants was key to preventing nappy rash. Natural remedies. Emma's wisdom extended to natural remedies. For mild cases, consider using natural remedies like coconut oil, she shared. The soothing properties of coconut oil could contribute to healing and preventing further irritation. Prompt professional advice. For persistent or severe nappy rash, Emma urged parents to seek professional advice. Your pediatrician can provide guidance on suitable treatments, she affirmed. Timely intervention ensured effective solutions tailored to the baby's needs. Emma's journey through the world of nappy rash was filled with tried-and-true methods that resonated with fellow caregivers. Her expert guide became a beacon of support, empowering parents. Experienced caregiver, Emma understood the trials that came with a teething baby. Sharing her expertise through relatable stories and practical advice, she became a guiding light for parents like Lily's mom. Recognizing teething signs. Emma knew that teething brought discomfort. Look for signs like excessive drooling, irritability, and a desire to chew, she advised. Understanding these cues helped Lily's mom identify teething troubles early on. Gentle gum massage. One of Emma's go-to techniques was a gentle gum massage. Use a clean finger to massage Lily's gums, she suggested. The gentle pressure provided relief and comfort as those tiny teeth made their way through. Chilled teething toys. Emma believed in the power of chilled teething toys. Let Lily chew on a chilled, but not frozen, teething toy, she recommended. The coolness helped soothe inflamed gums and provided a safe, gnaw-worthy distraction. Teething rings with texture. Emma favored teething rings with various textures. Opt for rings that have different surfaces for added comfort, she shared. The texture design allowed Lily to explore and find the right soothing sensation. Cold washcloth technique. A simple yet effective remedy in Emma's arsenal was the cold washcloth technique. Dampen a clean washcloth, freeze it, and then let Lily chew on it, she suggested. The cold cloth numbed the discomfort and offered relief. Teething biscuits in moderation. Emma cautiously introduced teething biscuits to Lily's menu. Give teething biscuits in moderation once Lily starts solids, she advised. The gnawing action on the biscuit helped relieve teething pressure. Natural teething gels. Emma recommended natural teething gels for additional relief. Look for gels with natural ingredients like chamomile, she suggested. Applying a small amount provided a gentle, herbal solution to ease discomfort. Distraction through play. Keeping Lily engaged became Emma's secret weapon. Distract Lily with age-appropriate toys and games, she shared. Playtime helped take Lily's mind off teething discomfort, making the experience more bearable. Comforting cuddles. Emma understood the power of comforting cuddles. Sometimes, all Lily needs is some extra love and cuddles, she emphasized. Providing a safe and secure environment helped Lily navigate the emotional aspects of teething. Stay attuned to individual needs. As an expert, Emma stressed the importance of staying attuned to Lily's individual needs. Every baby is different, so tailor your approach based on what suits Lily best, she advised. A personalized strategy ensured comfort and care tailored to Lily's unique preferences. Emma's journey through teething challenges with Lily was filled with warmth, understanding, and practical solutions. Her expert guide became a trusted companion for Lily's mom and others, offering a roadmap through the teething adventure with grace and expertise. In the small town where Emma lived, she was known for her caring nature and expertise in child health care. Today, she decided to share her insights on the importance of infant vaccinations and the role they play in building a foundation for a healthier future. The starting line. Emma emphasized the significance of vaccinations as a starting point for a baby's health journey. Just like a tiny superhero putting on armor, vaccinations shield your baby from serious illnesses, she explained to anxious parents. The trusty vaccine schedule. Emma unfolded the vaccine schedule like a treasure map leading to a healthy future. Follow the recommended vaccination schedule provided by healthcare professionals, she advised. Each vaccine played a crucial role at specific stages of infancy. The power of early vaccination. Emma highlighted the power of early vaccination. Starting vaccinations early ensures that your baby builds immunity when they need it most, she shared. Protecting against diseases like measles, mumps, and rubella became a superhero mission. The importance of routine checkups. Routine checkups, according to Emma, were the checkpoints on the health journey. Regular doctor visits help track your baby's development and ensure they're on the right path, she reassured worried parents. Superheroes and tiny needles. Emma compared vaccines to tiny superheroes disguised as needles. These superheroes train your baby's immune system to recognize and fight off potential invaders, she explained. The battle happened on a microscopic level, ensuring real-world protection. The safety net effect. Vaccinations, in Emma's words, created a safety net around the community. When everyone participates, we create herd immunity, protecting those who can't be vaccinated, she stressed. It was a collective effort for a healthier town.
Combating myths and misconceptions. Emma addressed common myths surrounding vaccinations. Trust the science and consult with healthcare professionals to dispel any concerns, she urged parents. Separating fact from fiction was crucial for informed decision-making. Celebrating small wins. As babies received their vaccinations, Emma celebrated small wins. Every shot is a step closer to a healthier tomorrow, she cheered. It was a journey filled with tiny victories, building resilience against preventable diseases. Nurturing a positive environment. Emma highlighted the role of a positive environment during vaccinations. Create a comforting atmosphere during and after shots, showering your baby with love and comfort, she recommended. A reassuring hug could work wonders. The parental support system. Closing her session, Emma emphasized the parental support system. Parents, you're the real superheroes, guiding your little one through this health adventure, she praised. Encouragement, love, and informed decisions were the tools for success.
Emma's guidance on infant vaccinations left parents feeling empowered and ready for their baby's health journey. With vaccinations as their trusted sidekick, babies in the town were set on a path toward a healthier and brighter future. As we draw this video to a close, I want to express my genuine gratitude for your time and attention. Crafting this content has been a labor of love, fueled by the aspiration to provide you with meaningful insights and valuable knowledge. Your commitment to staying engaged until the end is sincerely appreciated. Remember, knowledge is a powerful tool that empowers us to make informed decisions and lead healthier lives. If you found this video informative and engaging, don't hesitate to hit the like button and consider subscribing for more enriching content. By doing so, you become part of a community that values learning and growth. Thank you for allowing us to be a part of your journey. Let's continue to explore, learn, and evolve together. Until next time, take care and be well.